10 evidence-based foods that quietly help your heartbeat feel steadier. No supplements, no hype, just everyday choices you can pick up at the grocery store and fold into real meals. The idea is simple. Foods richer in potassium can help your body balance sodium and support the tiny electrical currents that keep the heart's rhythm on track. That's not a promise of cure. It's a nudge toward habits linked with calmer blood pressure and fewer rhythm bumps, especially when combined with your doctor's plan. You're in a place for plain language, research-based guidance. Sources like the World Health Organization, the American Heart Association, and major clinics inform what you're about to hear. This video is educational and does not replace individual medical care. Let's start with pantry heroes you might already own: white beans. These humble beans deliver potassium alongside fiber and plant protein, a helpful trio for blood pressure and cholesterol. According to the American Heart Association, patterns like the DASH-style way of eating, naturally higher in potassium and fiber, are associated with healthier blood pressure and heart outcomes. Stir beans into soups, toss with olive oil and lemon, or spoon them over a salad. Common mistake: adding lots of salt when simmering. Rinse canned beans under water and season with herbs, garlic, or a squeeze of citrus instead. Speaking of pantry staples, there's more than one way to get steady heart nutrients without expensive superfoods. Avocado is next in the everyday toolbox. Beyond being a well-known potassium source, it brings heart-friendly monounsaturated fats that pair beautifully with tomatoes or eggs. Harvard Health has repeatedly highlighted how swapping saturated fats for unsaturated fats may support healthier lipids and blood vessels. Mash half an avocado on whole grain toast, add sliced tomatoes, and sprinkle crushed pepper. Delicious, filling, and friendly to your cardiovascular system. Common mistake: drowning avocado in salty toppings. Choose fresh herbs, chili flakes, lime, or a little extra virgin olive oil to keep sodium in check. And remember, portion sense. Creamy doesn't need to mean heavy-handed. Leafy greens like spinach or Swiss chard are quiet powerhouses. Lightly sautéed or folded into omelets, they deliver potassium plus magnesium, both involved in normal muscle and nerve function, including the heart's electrical wiring. The NIH Office of Dietary Supplements notes that potassium helps counteract sodium's effect on blood pressure by promoting sodium loss in urine, a practical reason to add greens to lunch or dinner. Try a quick skillet: olive oil, garlic, a big handful of greens, finish with lemon. Common mistake: using salty broths or cheeses that cancel the benefit. Keep the flavors bright with acid and aromatics, not the salt shaker. If you've been told your kidneys aren't filtering well, talk with your clinician before making big leafy green increases. For an easy weeknight side, sweet potato, ideally with the skin, adds a gentle sweetness alongside potassium and fiber. The World Health Organization's guidance on potassium underscores its association with modest reductions in blood pressure and stroke risk in populations with low intake. Roast wedges with paprika and a drizzle of olive oil, or make a simple mash with plain yogurt for creaminess. Common mistake: piling on sugary toppings or marshmallow-style casseroles. Keep it savory and pair with a protein and a plate of greens for balance. Little swaps like this add up over a month. Tomato paste or puree is a sneaky concentrated source of potassium because it's basically many tomatoes in a spoonful. It's also an easy base for quick sauces and stews. Cleveland Clinic dietitians often point people toward tomato products as practical potassium contributors. Just look for low-sodium labels. Bloom a tablespoon of tomato paste in olive oil with onion and garlic, thin with water, then simmer. Common mistake: jarred sauces loaded with salt and sugar. Read the label. Choose no salt added when you can. Your taste buds adapt in a couple of weeks, and the heart appreciates the lower sodium habit. Plain yogurt, whether low-fat Greek, Skyr, or a quality plain option, brings potassium plus protein, which helps with satiety and weight management, another dimension tied to blood pressure and heart risk. Mayo Clinic's heart guidance often emphasizes whole food patterns over quick fixes. Yogurt fits that approach when you pick unsweetened varieties. Build a breakfast bowl with berries, a modest sprinkle of oats or nuts, and a dash of cinnamon. Common mistake: flavored yogurts that hide a dessert's worth of sugar. Choose plain and sweeten gently with fruit. If you limit dairy, lactose-free or cultured options can still work. Just keep an eye on added sugars and sodium. Dried fruits like apricots or prunes offer portable potassium, useful on busy days or travel. They can support regularity and pair well with a handful of unsalted nuts for a quick snack. Harvard-affiliated nutrition resources frequently remind that dried fruit is concentrated. A small portion goes a long way, so a few pieces are plenty. Combine chopped dried apricots with parsley, lemon, and olive oil for a bright grain salad. Common mistake: turning the bag into a bottomless snack. Pre-portion a small handful and drink water to balance the natural concentration. If your doctor has flagged high potassium levels or advanced kidney issues, discuss dried fruits before adding them regularly. Salmon brings a 2-for-1: potassium and omega-3 fats. Omega-3s have been linked with heart benefits in many studies, and pairing them with a potassium-containing whole food makes salmon a convenient dinner anchor. The American Heart Association suggests fish, particularly fatty fish, about twice a week as part of Heart-Smart patterns. Roast salmon with lemon and herbs. Serve alongside a mixed salad and those roasted sweet potatoes. Common mistake: heavy, salty glazes or soy sauce marinades that push sodium up. Lean towards citrus, fresh herbs, mustard, and pepper for clean flavor that respects your blood pressure. Citrus like oranges and little green powerhouses like kiwi make for practical peel-and-go options with a refreshing potassium bump. The NIH notes that fruits and vegetables generally contribute most of the potassium in a balanced diet. Think whole fruit more often than juice. Slice kiwi into your yogurt bowl or keep an orange in your bag for an afternoon reset. Common mistake: relying on fruit juice daily. Whole fruit preserves fiber, steadies blood sugar response, and keeps portions honest. If you love juice, consider a small glass a few days a week and favor water or unsweetened tea the rest of the time. And when heat or exercise raises your electrolyte needs, unsweetened coconut water can be a reasonable, light option. It's naturally rich in potassium with a clean, not too sweet profile. Many cardiology clinicians encourage people who perspire a lot to replace fluids thoughtfully. Coconut water can help on hot days, but it's not a free-for-all. Common mistake: sipping it all day as if it were water. Use it situationally, check labels for added sugar, and prioritize plain water for baseline hydration. If you take ACE inhibitors, ARBs, or potassium-sparing diuretics like spironolactone, ask your doctor how to fit potassium-rich drinks into your plan. Quick reminder as we connect these foods to rhythm: potassium supports the movement of ions across cell membranes, which helps govern how heart muscle cells fire in sequence. WHO recommendations about increasing potassium while moderating sodium intake are consistent with lower average blood pressure across populations. That doesn't mean everyone should load up without limits. People with chronic kidney disease or certain endocrine conditions may need to be careful, and anyone with palpitations or known arrhythmias should keep their clinician in the loop about diet changes, especially if labs have shown high potassium before. Food first is a smart default, but safety first comes with it. Here's how to put this into practice today. Start where it's easiest. Beans on Monday, greens on Tuesday, sweet potatoes on Wednesday, salmon Thursday, yogurt Friday, fruit on the weekend. Simple swaps keep momentum going. Replace a salty snack with a small pot of yogurt and kiwi. Fold white beans into a canned low-sodium tomato soup. Trade a sugary dessert for a few dried apricots plus a square of dark chocolate. These are realistic moves that respect time and budget and still serve your heart. To make the most of it, capture what you actually eat. For the next 7 days, jot down where potassium-rich choices show up: breakfast, lunch, dinner, or a snack. Then make one change today, not 5. Maybe it's that bean and tomato salad for lunch or roasted sweet potato with dinner. Finally, if you take heart or blood pressure medications or have kidney concerns, send a quick note to your healthcare team before big changes. They can advise on lab checks and portion targets. According to Cleveland Clinic and other major centers, balancing medications and minerals is part of safe cardiac care. Food can be powerful, and powerful deserves supervision. Let's land this with a lightning recap you can picture on your next grocery run. Stock white beans, keep avocados and citrus in rotation, load leafy greens into omelets, roast sweet potatoes, use tomato paste for fast sauces, choose plain yogurt, pre-portioned dried apricots or prunes, plan salmon once or twice a week, enjoy kiwi and oranges whole, save coconut water for those extra hot or extra sweaty days. Small, steady choices today may help your heart stay calm for more years with the people you love. Before you go, tell me in the comments which swap you're trying this week. Share this with someone 50+ who cares about their heart, and subscribe for practical, science-based tips that fit real life. Information guides. Don't stop or change medications on your own. Talk to your doctor.